Right now, somewhere in your body, there is a muscle holding on for dear life, gripping so hard, so tight, it has forgotten how to let go. And every doctor you have ever seen, every scan, every X-ray, every pill, none of it touched that muscle. Not once. Here is what no one told you. A study published in the journal Spine found that over 85% of people with chronic back pain had no identifiable structural cause. No herniated disc, no bone damage, nothing on the imaging, and yet the pain was absolutely real, debilitating, life-stealing, and what I am about to show you changes everything. I am Dr. Helen. In 20 years of practice, I have seen this work when everything else failed. So let me ask you something. When your back hurts, where do you go in your head? You think about your spine, right? You picture a disc slipping, a nerve pinching, something in there just grinding wrong. That is what we have all been taught. That back pain equals spine problem. And that assumption, that one single assumption, is why millions of people are still suffering. Here is what is actually happening. Your back has a group of muscles called the psoas. Most people have never heard of it. It runs from the very bottom of your spine all the way down through your pelvis and connects at the top of your thigh bone. It is the deepest muscle in your entire body, and it has one job it does better than almost anything else in the human body. It holds tension. Think of it like this. Imagine a rubber band stretched between two posts. Now leave it there for years. What happens? It does not go back to its normal shape. It stays shortened. It stays tight. It starts pulling on everything around it, the posts, anything connected to it. That is your psoas after years of sitting at a desk, years of stress, years of your body bracing for something that never came. When the psoas is chronically tight, it yanks on your lumbar spine. It compresses your lower vertebrae. It tilts your pelvis forward, and it creates a cycle of pain that no MRI can fully explain because it is not structural. It is muscular. It is tension that has been living in your body so long it has started to feel normal. The shocking part is this. When you go to your doctor with back pain, what happens? They send you for imaging. The imaging might show a slight disc bulge, something that half of pain-free people also have, by the way, and suddenly that becomes the story. That becomes the diagnosis. The psoas never gets mentioned, the tension pattern never gets addressed, and the pain just keeps coming back. You were not lied to on purpose, but the system missed something massive. And today that changes. What I am going to give you right now is called a psoas release sequence. It is not yoga. It is not stretching in the way you are thinking. It is a specific, targeted intervention that signals your nervous system to stand down, to stop the alarm, to finally let go. And here is where the science gets exciting. A landmark study published in the Journal of Orthopaedic and Sports Physical Therapy in 2012 looked at patients with chronic lower back pain who had failed every conventional treatment. Medication, physical therapy, injections, nothing had worked. When researchers introduced targeted hip flexor release and neuromuscular re-education, which is exactly what this sequence does, 73% of participants reported significant pain reduction within 4 weeks. 4 weeks? Not 4 years. 4 weeks. Now here is what most people get wrong, and this is the thing that quietly kills their progress. They go after the pain. They rub the place that hurts. They put heat on their lower back. They foam roll their spine. But the psoas is not where the pain is. It is where the pain comes from. There is a massive difference. If you only treat the symptom, the tension resets overnight, and you wake up back at square one. So here is exactly what you are going to do, and I want you to do this today. Step 1. You are going to find a firm surface. Your bed is too soft? Use the floor or a yoga mat. You are going to lie on your back with both knees bent, feet flat on the floor. Just breathe for a moment. Let your lower back soften toward the floor. Do not force it. Just notice it. This is called constructive rest, and it alone begins to decompress the lumbar spine. Step 2. Very slowly, Bring one knee up toward your chest. Hold it gently with both hands, not aggressively. You are not trying to force a stretch. You are creating a gentle traction on the hip flexor, on the psoas. Hold this for 90 seconds. Breathe slowly the entire time. If you rush this step, you activate the very tension you are trying to release. Patience here is not optional. It is the mechanism. Step 3. Now this is the part most people skip, and it is the most important part of this entire sequence. While you are holding that knee, I want you to take a slow breath in through your nose for 4 counts, and then exhale through your mouth for 8 counts. A double-length exhale. Do this 5 times in a row. What you are doing is activating your parasympathetic nervous system, your rest and digest state. This sends a direct neurological signal to the psoas muscle. It tells your body the threat is over, the guarding is no longer needed, and the muscle physically begins to release. Without this breath work, you are just pulling on a muscle. With it, you are talking to your nervous system. Step 4. After your 5 breath cycles, slowly lower that leg back down. Take a moment and notice how that side of your lower back feels compared to the other side. Most people feel a noticeable difference already, a warmth, a softening, a sense of space they have not felt in years. Now repeat the entire thing on the other side. Step 5. Once you have done both sides, you are going to move into what I call the 90-90 position. You lie on your back and place both legs up on a chair or couch so that your hips and knees are both at 90-degree angles. This takes all load off the lumbar spine entirely. Stay here for 5 minutes. Just breathe. Let gravity do the work. Now, I want to talk to you about timing because this matters enormously. The single best time to do this sequence is first thing in the morning before you stand up. Here is why. While you sleep, your psoas does not fully reset if it has been chronically tight for years. When you stand up and start moving, you are loading a muscle that is already gripping. Doing this sequence before you even get out of bed means your spine starts the day in the best possible position. Do it again in the evening, especially if you have been sitting for long periods. Sitting is the slow poison for the psoas. Every hour of sitting shortens it a little more. Every evening, release gives it back what the day took away. The other thing I need you to understand is that this is not a one-and-done solution. The psoas took years to get tight. It will not be permanently free after one session. But here is what happens. The first time you do this, you might feel 20% better. The second week, 40%. By week 4, patients in my practice regularly tell me they feel better than they have in a decade, because the underlying pattern is finally being addressed instead of masked. One more thing, and this is critical. Most people hold their breath when they feel pain or discomfort. The moment their back twinges, they brace, they tighten their core, they hold their breath. This is a survival reflex, and it is making everything worse. Bracing the core in response to pain actually increases intra-abdominal pressure, compresses the lumbar discs further, and tells your psoas to grip harder. The opposite of what you need. So from today forward, when you feel pain, your first response is to exhale. Long and slow. Drop your shoulders. Let your belly soften. This single habit change is something I have seen transform people's daily pain levels faster than almost anything else. I have had patients come into my office after a decade of back pain, after surgeries, after injections, after being told they would just have to live with it. And within weeks of finally addressing the real source, they are doing things they had given up on, walking without stopping to rest, playing with their grandchildren, sleeping through the night without waking up in pain. I am not telling you this is magic. I am telling you that the right signal sent to the right place changes everything. Your body has been waiting for this signal. Now you know how to give it. You are not broken. You were just never shown the door. I want to know where you are watching this from. Drop your city in the comments right now. Seriously, just your city. You would be amazed how many people watching this are from the same place as you, dealing with the exact same thing and feeling completely alone in it. You are not alone. And if you know someone who has been struggling with back pain, someone who has tried everything and is starting to lose hope, please send this to them today. Not later. Today. This might be the video that gives them their life back. I mean that. This video is for educational purposes only and does not replace the advice of your personal physician. Always consult your doctor before making changes to your diet or lifestyle.